Unit 12 CVS questions 51. A nurse is discussing smoking cessation with a client diagnosed with coronary artery disease. Which statement would the nurse make the client to try to motivate the client to quit smoking? 1. If you quit now, your risk of cardiovascular disease will decrease to the non-smoker in 3 to 4 years. 2. Since most of the damage has already been done, it will be alright to cut down a little at home. 3. If you totally quit smoking right now, you can cut your cardiovascular risk to zero within a year. 4. None of the cardiovascular effects are irreversible, but quitting might improve the lung cancer. The correct answer is 1. If you quit now, your risk of cardiovascular disease will decrease to that of a non-smoker 3 to 4 years. 52. A client with heart failure is scheduled to be discharged to home with digoxin furosemide as ongoing prescribed medication. The nurse teaches the client to report which of the following items indicating that the medication are not having the intended effect. 1. Cough accompanied by the signs of respiratory infection. 2. Sudden increase in appetite. 3. Weight gain 2 to 3 pounds in a few days. 4. High urine output during the day. The correct answer is 3. Weight gain 2 to 3 pounds in a few days. 53. A client has experienced an episode of pulmonary edema. The nurse determines that the client's respiratory status is improving. Alter this episode if which of the following breath sounds is noted. 1. Rails throughout the lung fields. 2. Crackles in the bases. 3. Wheezes. 4. Bronchi. The correct answer is 2. Crackles in the bases. 54. A client with pulmonary edema has an order to receiving morphine sulfate intravenously. The nurse evaluates that the client experienced an intended effect of the medication if which of the following assessment data is noted. 1. Relief of appreciation. 2. Decreased urine output. 3. Increased pulse rate. 4. Increased blood pressure. The correct answer is 1. Relief of apprehension. 55. A client within a myocardial infarction is recovering from cardiogenic shock. The nurse interprets that which of the following observation of the client's clinic condition is most favorable. 1. Central venous pressure is 15 mmHg. 2. Frequent premature ventricular contraction. 3. Urine output 40 ml per hour. 4. Heart rate of 110 beats per minute. The correct answer is 3. Urine output 40 ml per hour. 56. A client is scheduled to begin therapy of acetaminophen for the management of glaucoma. Prior to the initiating therapy, the nurse assesses the client history of allergy sensitivity to which of the following? 1. Corticosteroids. 2. Non-steroid anti-inflammatory agents. 3. Penicillin. 4. Sulfa drugs. The correct answer is 4. Sulfa drugs. 57. A client recovering from an exacerbation on left side heart failure has a nursing diagnosis of activity intolerance. The nurse evaluates that the client is best tolerating mild exercise if the client exceeds which of the following changes in vital signs during activity. 1. Pulse rate increased from 80 beats per minute to 104. 2. Respiratory rate increased from 16 breaths per minute 19. 3. Oxygen saturation decreased from 96% to 91%. 4. Blood pressure decreased from 140 by 86 mmHg to 112 by 72 mmHg. The correct answer is 2. Respiratory rate increased from 16 breaths per minute to 19.